Hello everyone, welcome back. Today I'll be covering regarding a pelvic trauma, a summary. Remember, a summary that's mean is especially done for the medical student and revision for the master student. Okay, now let's get started. Anatomy. The pelvis is a ring structure composed of bone. It consists of the sacrum, coccyx, and the innominate bones, the pubis, the ischium, and ilium. The innominate bone join to form the acetabulum. The innominate bones join anteriorly at the pubic symphysis. It contains the blood vessels, the nerve, urogenital organs, and the rectum. This picture illustrates the innominate bone, the ilium, the pubis, and the ischium, and the other bony prominences and the joint. The ASIS, acetabulum, can see the sacrum, coccyx, sacroiliac joint. Regarding the blood supply, this picture illustrates the blood supply at the area of pelvic region. Started off with the abdominal aorta, then it can be divided into common iliac artery, then external iliac artery, and internal iliac artery. Then it branches off to all the small other artery like inferior epigastric artery, obturator artery. So depends on the organ that they supply. Uterine artery and superior vesical artery. The aorta divides into common iliac arteries at the L4 level. The common iliac arteries further divide into the internal and external branches at the sacroiliac joint. The superior gluteal artery is the most commonly injured vessels in the pelvic trauma. This picture illustrates the blood vessels of the area pelvic, especially the vein. You can see there's the inferior vena cava that divide into the left common iliac vein and the right common iliac vein. Then this common iliac vein will divide into the external iliac vein and the internal iliac vein. From the previous illustration, you can see they accompany the artery. So the veins that accompany the arteries are more prone to injury. The proximity of the veins and arteries account for the high incidence of combined injury that will lead to hematoma or hemorrhagic shock. The next picture illustrates the nerve supply of the area lumbosacral plexus. So we started off from the iliohypogastric nerve, that is IH, ilioinguinal nerve, II, lateral femoral cutaneous nerve, LFC, the genitofemoral nerve, GF there, the femoral nerve, the obturator nerve, O, C is the common fibular nerve, and T is the tibial nerve. You can see the origin and the cause of the nerve by this illustration. Nerve injuries are less common. Lumbosacral plexus injury is the majority. It is due to close proximity to the sacroiliac joint and the acetabulum. Injury occur due to traction or compression from a retroperitoneal bleed. The types of pelvic injury. Pelvic injuries are usually caused by a significant trauma, Example, motor vehicle accident, fall from the heights, or a crash injury. Due to location of the pelvis, injuries to other structures such as blood vessels, the bladder or bowel may occur. The management and the long-term recovery from the pelvic injuries can be complicated. The common classification that I use is the Young and Burgess classification. For A, APC, anteroposterior compression, there will be a widening of the pelvic ring, widening of the sacroiliac joint, open book fracture. It's commonly known as an open book fracture. This picture illustrates the open book fracture or APC, anteroposterior compression fracture, based on the direction of the injury. So anterior and posterior. Anteriorly, you can see there's a widening of the widening of the symphysis pubis and destruction of the ligaments that bring stability to the pelvic, and then the sacroiliac joint is also open up, but the posterior sacroiliac joint is still spared. B, regarding the lateral compression injury, is the most commonest. There is a displaced fracture of the pubic bone and risk of the broken bone causing damage to the underlying organ, example, the bladder. So this picture illustrates the direction of the injury laterally, causing a compression and fracture at the area of pelvic region. And the most commonest injured organ is the bladder. C, regarding the vertical shear injury. It's a very unstable fracture, high energy shearing force. There will be a major disruption of the pelvic ring, the sacroiliac joint, the ligaments, and the blood vessels. The high energy usually due to a patient fall down from a significant height. This picture illustrates the vertical shear fracture, whereby there's a fracture through and through with an opening of the posterior sacroiliac joint. The treatment or management of the pelvic fracture. Just summarize again. We always started off with primary survey, A, B, C, D, E. A is airway and cervical spine protection. B is for breathing. C is for circulation. D for disability, whereby at this D, we need to assess the Glasgow Coma Scale, GCS. The exposure and environmental control is E. Remember, adequate resuscitation is crucial. 2 large bore intravenous should be placed. Hypotension addressed with aggressive fluid resuscitation, followed by blood products if the patient remains hypotensive. Regarding pelvic binders, we use if there is a signs of pelvic ring disruption. There's 2 ways to decrease the bleeding by pelvic binders. 1, it compresses the bleeding from the bone. 2, it decreases the volume within the pelvis, causing a tamponade effect. But remember, it's only temporary. It should not be placed in a lateral compression fracture as it can increase bleeding. Okay everyone, I hope you have learned something from this video. See you in the next one. Take care and bye.